man FDL and really unhappy. Not my patient. I should put a disclaimer. Not my patient. It's fine if you are I'm okay with that. But it's anyway. 8 months post-op from an FDL and really unhappy. My surgeon says he's removed the most he can. I wonder if I could have a tummy tuck as the excess skin is above my scar and under my belly button. Right, I'm gonna wait till my battery goes red. Then I'm going to take action. Tricky, and you know what? I can sort of get an impression of what's happened here. The problem with this thing is you've had an FDL, you've had a fleur de lis tummy tuck. Now, a fleur de lis tummy tuck is an inverted T tummy tuck, viewers. It's a big tummy tuck basically, and it's a normal tummy tuck is just a scar in your bikini line when you just pull the skin down. A fleur de lis is when you pull the skin to the side, so you've got an excess not only in an up down direction, you've got an excess in a side to side direction. So you pull it down and you pull it side to side and you get this inverted T-shaped scar. So it's basically a bigger version of a tummy tuck. So people who need a fleur de lis tummy tuck are usually people who've had massive weight loss, and people who've had massive weight loss have stretched the skin. And so the skin has been stretched and the skin is often damaged. There's often evidence of that in terms of stretch marks. And so the problem we have is when we do these tummy tucks, with the skin we're leaving behind is damaged skin. The skin that you've left has damaged skin, is not as elastic as you would like it to be because it has been stretched by, in terms of a tummy tuck, is usually pregnancy or weight loss. Those things have stretched the skin and the skin is damaged. So the resulting skin that you left behind is not as elastic, it's not as tight as you would want it to be. So we've got to get a balance between getting the skin to heal, because that is the big problem with tummy tucks in general, particularly fleur de lis tummy tucks. One of the risks is it doesn't heal up properly. A wound breaks down, get wound infections, all sorts of problems like that in terms of a fleur de lis tummy tuck. So we don't want that. But at the same time, we want you to be happy, and we want you to feel as tight as a drum, and we've done a fantastic job, and you've got a washboard stomach. But that's hard when the skin itself has lost its elasticity. So it's always a balance. So you're unhappy because you feel that you've got excess skin. So your surgeon was probably trying to make sure you healed up okay, but now you're like, oh, I've got excess skin. So really, really tough. And I think 8 months post-op, I wouldn't do anything. I think it's way too soon. Could I have a tummy tuck? You've probably not got enough skin for a tummy tuck. Probably. I mean, I've not seen you. I don't know anything about you, but I would imagine you haven't got enough skin for certainly not a full tummy tuck. Could you have a mini tummy tuck? I guess you could, especially if there's just a bit of skin just above the horizontal scar, just to tighten that bit of skin. If there's above my scar, under my belly button, yeah, maybe a mini tummy tuck just to tighten that bit of skin. I've always said go with your surgeon and work with the surgeon because they've got a vested interest to try and make things right. So a little revision might be a thing. I don't know. I mean, I haven't seen you, but it could be done. The problem with mini tummy tucks is they do pull the belly button down a bit because you don't make a scar on the belly button, so it pulls the belly button down a bit. Also, you've got to be a bit careful because you've got that vertical scar, so you've got to, not to put not too much tension on that because always at the T junction is the worst place in terms of healing. So, got to be careful. I'd probably be waiting at least a year, really, but look at the revision policy of the hospital because they might say you've got revisions, for a year, and then they don't want to say at 13 months. Okay, we'll do a revision, but with you're going to have to pay for it. Whereas if you'd had it done at 11 months, you wouldn't have to pay. So that's one thing to consider. But tricky one, and I think one of the problems is to realize that it is difficult when your skin has been stretched and damaged to make it really tight as a drum. That maybe that what you would like, and what your vision of the result is, sounds different to what the surgeon's vision of the result was, because the way you've worded that, my surgeon says he's removed the most he can, suggests maybe your surgeon's happy with the result, which makes me think, oh, right, well, maybe it's your skin that, you just try and make it tight and you do the surgery and it's tight as a drum when you do the surgery, but then 2 weeks later, it's lost that tightness because of the intrinsic elasticity of your skin. Right, what's going on here? What's going on?